4's Plastic Surgery Today with Dr. Stanley Jacobs.
All right, today we're talking to the doctor about natural nose jobs because, you know, while a little ski jump is nice in the Olympics, you don't necessarily want yours to look, you know, and noses are weird. It's like, you know, like I would say, hey, can you just fix my bump? And then suddenly something looks wrong and I'm not quite sure what. It should be perfect.
Well, it should be balanced and natural looking.
Right.
And that's the whole topic today is the natural nose job. What is it that we can do as surgeons to make it look very natural?
Yeah.
As opposed to, you know, you can say, oh, that doesn't look right. From a lay perspective, from the surgeons, we want to look at every little angle to make it look balanced. And sometimes you don't need to do a lot.
But wait, are you telling me then I can't go through my Us magazine, pick out a star's nose and go, I love her nose.
You
Can
can't
you just
do that.
put it on me?
You can't because your facial proportions, your eye width doesn't match that. So the best thing is to have, you know, talk to the doctor.
Okay.
We've got four different patients to show.
Okay.
So we can kind of, if we could pull those pictures up, that would be great.
Okay. All right.
And for instance, this lady, you know,
so she just had the bump.
She had a bump, but if you look at it carefully, if you just take a bump down, the nose actually looks longer, you know, optically. So you then have to say, well, what about bringing it in slightly, and what about the angle between the nostril arch and here? So what we did was not just do that.
I can see
we
that.
also make this a little closer.
And
to her face,
doesn't go,
and this angle's a little bit better.
Yeah.
And the relationship of the nostril to the tip is better. So, but those are refinement type of points that you wouldn't normally know yourself.
Right. She'd just go and say, Doc, take off the bump.
Right. And then I say, okay, that sounds good. That's right. But we have to look at the balance, because if I just do that, she'll say, well, wait a minute, that doesn't look right. That doesn't match my nose.
Okay.
My face.
All right. Let's see another one. Okay, so I'm starting to get an idea. Okay, here's another one. Doc, take off my bump. And you say? There's
a bump too, but also, again, if you do that, the nose will look sort of flatter, longer, and it won't have sort of a tip definition, we call it.
Right.
So we want to make sure that the tip has some, you know, if we don't want just this to happen and then this not to have a definition to it.
I see what you're saying.
So the definition of the tip has to be there as well.
Okay, give us another one here. All right, so now this is not so much a bump, but it's just a
it's a bump as well. And so what it is this part's.
Hey, and by the way, that girl's, you know, pretty young. All right, anyway, so
she had a bump, and the top part was bone, and the bottom part's cartilage. So we have to make it look imperceptible. That's the whole beauty of it, is that you want to make it look like they never had a nose job.
Right, right.
Here's kind of, you could tell that, you know, but that's the beauty. There are certain things that a surgeon has to look at to make it so it looks natural. Thank you, Doc. If you have any questions, of course, you can contact Dr. Stanley Jacobs at the number you see on your screen, or go to his website at drstanleyjacobs.com.
This segment is sponsored by Dr. Stanley Jacobs.